The Covax plan to supply Africa with COVID-19 vaccines is gathering speed. 1 million vaccines have arrived in Nairobi, Kenya, and supplies have already arrived in other countries such as Angola and Rwanda, with more planned across various parts of Africa later this week. And to tell us more, I'm joined from Nairobi by James Elder. He's the senior spokesperson with Unicef. And Unicef, of course, is partnering with the World Health Organization for the Covax program. Thank you so much for your time this evening. So tell us, how many vaccines has Covax delivered in Africa so far?
Gosh, it's millions and millions. I mean, it's a great day. It's a great week. Like you said, Cote d'Ivoire and Ghana last week. Nigeria yesterday, 4,600,000. Angola, 1 million here where I am in Kenya. Hundreds of thousands, about 400,000 in Rwanda. Almost 2 million in the DRC. I mean, South Africa's got 10 million on order. So this is what we've been waiting for. It's just the beginning, but it's light. It's light at the end of the tunnel. And what's most important is that since we can see that, it's so critical that this COVAX facility shines light on everyone, particularly on those frontline health workers and most vulnerable. And that's what these vaccines are going to do.
So how is UNICEF working with this? I know that you're involved integrally with the WHO, but at what point do you hand over to the country, or do you get involved also in administering the vaccines in various countries?
Yeah, it is an enormous thing, and this has been day and night for everyone, but then everyone has also been enduring this pandemic. It starts with procurement. It starts with buying vaccines, and that often starts with working with donors. You know, that starts with sitting with those big counterparts, the European Union, the UK, the US, and reminding everyone that we're in this together. You know, no one's safe until everyone is safe. Let's talk about vaccine equity. So then procure them, get the money, get countries involved into this COVAX scheme, buy the vaccines, and of course that's, you know, a massive shout out to scientists over the last 6 months. Buy them, procure them, ship them, logistics, get them on the ground in those countries, then give them to the Ministries of Health, and then of course make sure you've got all that equipment, the storage, the transportation in country, so that you get them off the tarmac and into the arms of health workers and vulnerable people. It's a massive undertaking, but it's one that, you know, this is what UNICEF does. We do vaccines.
So how does COVAX prioritise which countries should receive their vaccines first?
Yeah, it's a great question. Essentially, COVAX is a voluntary scheme for lower and lower middle income countries if they want to put their name in to make sure that they are not left behind. So as soon as they have then, you know, become part of COVAX, they're then listed, and as soon as vaccines become available, they're distributed. And that's what we see happening now. Then you have other countries like South Africa, which have a sort of a dual power. They can be part of COVAX by paying for it as they're doing, and then they're making deals as well with the Pfizers and with the Johnson & Johnsons and so on, and that's going to mean tens of millions of vaccines. But this is for those low and lower middle income countries to make sure that no one is left out. So they become part of COVAX. For most of those countries, this is paid for through, as I say, the donor money, and then it's just as we wait for those 2 billion. The big aim this year is 2 billion vaccines across the world into those low and low middle income countries. It's just a start today. There's a long way to go, but it's a really good start.
Yes, and you mentioned 1 million vaccines in Kenya. Also, Lesotho has got vaccines as well today. So which countries are next on the list, and when is South Africa going to get their COVAX vaccines?
So next countries on the list, gosh, I mean, if I look just in Africa this week, Sudan, Malawi, Uganda, South Africa, as I say, through COVAX, probably in about a month, but at the same time has a major order through Johnson & Johnson, millions and millions, a major order through Pfizer. I'm talking double-digit millions here through both of those. So South Africa has placed itself very well there with large numbers through COVAX and its bilateral deals. But this week, yeah, we're going to see Malawi, Uganda, Sudan, Cambodia. We're really starting to see the rollout, which is pretty remarkable in terms of speed of turnaround of this science, of this vaccine, of getting it from the production, getting it onto the tarmac. But as we say, it's a first step, and we've got to ensure vaccine equity for everyone on the planet, not just those people in wealthier countries.
How concerned are you about the variants that we're seeing evolving? We've had some interesting news here in South Africa that the 501YV2 variant, which is dominant in South Africa and really pushed our second wave, that if you get that variant, you are immune not only to getting that variant again, but to other variants as well, it seems, at this stage. So are you prioritizing certain vaccines for certain areas? Are you concerned about the development of variants?
So, I mean, I would defer a lot to an epidemiologist on that one. With Covax facility, Covax delivers WHO-approved drugs. So at the moment, that's AstraZeneca and Pfizer. AstraZeneca, you'll remember, had a story in South Africa, though in the last 48 hours, we saw great data coming out of tests, new tests around AstraZeneca. Remembering, this vaccine is about saving lives. To end the pandemic, we will need many more vaccines. We'll need to keep social distancing. We will need masks. We will need to not have big indoor events and so on. The variants, now that you have the South African variant, the Brazilian, there's probably a dozen variants in countries because this is what viruses do. I don't think that is a huge concern to WHO. From everything I read, the real priority is that get AstraZeneca, get Pfizer, get Johnson & Johnson, whichever one it is. All of these seem to have great efficiency against the virus, against the variants, as you mentioned, and most importantly then about reducing mortality, which is what this big first rollout of all these vaccines is there to do.